Good morning. My name is Emily Wadle, and I was in a group with Faith Arnold and Grace Vandewater. So I'm going to be telling you about something that you most likely have heard about already in the recent past, and that's COVID-19. So COVID-19 is part of a family of viruses known as the coronavirus. They're named for the shape of the virus molecule. Corona means crown, and if you look at the molecule under a microscope, it looks like it has a crown of protein spikes around it. The coronavirus family is the cause of many viruses that are pretty common, such as the common cold and other respiratory or gastrointestinal or neurological diseases as well. Certain coronaviruses infect specifically animals, but every once in a while, rarely, we see a jump from coronaviruses that infect animals to humans, which is what happened with the novel coronavirus in 2019. It's an animal infection that somehow made it to humans, and it's taken so long to really figure out how to treat it because it's something we've never seen in humans before. So the coronavirus is spread from person to person through droplets when an infected person sneezes or coughs or does other things like singing around other people. What happens is these droplets get sprayed out a few feet ahead of you, and they can cover surfaces, or they can even get on other people. And this is what can lead to other people getting infected. When a person is exposed to COVID, usually if they contract it, symptoms will start to appear within 14 days after that. These symptoms include coughing, fever and chills, shortness of breath, difficulty breathing, body aches, sore throat, new loss of taste or smell, diarrhea, headache, fatigue, nausea or vomiting, congestion or runny nose. So we see this novel coronavirus affecting all of the areas that coronaviruses can. We see it taking out the respiratory system, the GI system through the diarrhea and nausea and vomiting, as well as the neurological system with the loss of taste and smell. But it is really important to know there are still other respiratory diseases, and these are just as important that we watch and take care of, because things like influenza can be just as dangerous and can also be fatal. Precautions must be taken for these diseases as well. To diagnose someone with COVID-19, it's usually pretty difficult to just do it with a physical exam, simply because these symptoms can often just look like the flu or the common cold. Laboratory tests can confirm the diagnosis, and a healthcare provider will take a sample of your respiratory fluids. So they'll take it looks like a really long Q-tip, and stick it up your nose and either go all the way to the back of your throat or go to the back of your nasal cavity, or just swipe the inside of your nose holes. You can either be tested with a viral test to tell if you're currently infected, or have an antibody test to see if you have been infected in the past. This is part of the PSA. We need to know who the high-risk groups are. People who are older than 65, people who are older than 55 and have pre-existing conditions of heart disease, high blood pressure, COPD and asthma, or people older than 12 if they have obesity, diabetes, chronic kidney disease, or a weakened immune system. For those of us who are healthy and not part of these high-risk groups, we may still contract the disease, but it's nowhere near as dangerous for us. So we need to be looking out for these people. There's really no specific treatment for COVID-19, but we have learned how to give supportive measures to people and help with managing their symptoms. I have the wrong document pulled up. Sorry, 1 second. Where is it? Oh no. Okay, well, I'm just gonna wing it. So there are multiple different therapies that can be tried on people who have more severe cases, such as research drugs. One of the more controversial ones was hydrochloroquine at one point, and there are other research therapies that are being researched as well, such as monoclonal antibody therapy. So what that is in a laboratory, they have synthesized an antibody that is very effective against the COVID-19 disease. What happens is they give you an infusion of this. It's not a blood infusion, and it's not plasma from someone who has antibodies. It's an actual injection of lab synthesized antibodies into someone who is sick. So it's different from a vaccine. The vaccine is for someone who's healthy. The monoclonal antibody therapy is for someone who is already sick. Like I said before, there is another treatment that's available. It's not really a treatment, it's more of a preventative measure, and that's a vaccine. And there's multiple that have been already approved by Pfizer and Moderna, and a few that are also working on getting approval now, AstraZeneca and Johnson & Johnson. Prognosis for people who have COVID, usually pretty good, but it really depends on the case and viral load of the individual. People may be fine after the virus runs its course, or they may be left with long-term or permanent smell or taste loss. But unfortunately, we have also seen this disease causing fatalities to occur, but it's usually just for those people in the high-risk group. The final part of the PSA portion of this is the prevention. So it's really important, and I'm sure you've heard this many, many times, how to prevent this disease from spreading, but reduce contact with other people. And if you are around other people, stay about 6 feet away from them, just so that those particles don't reach them when they spray out of your mouth. Avoid people who are sick or experiencing symptoms. That's not just for COVID, that's also to avoid getting the influenza or other respiratory diseases. Practice good hygiene. Wash your hands well with soap and water for at least 20 seconds and scrub them good. Or use a hand sanitizer with at least 60% alcohol. Cover your coughs and cover your sneezes in the crook of your elbow, and if you do use a tissue, throw it away immediately and then sanitize well. Another controversial point of this is possibly getting the COVID vaccine. There's a lot of people who don't feel comfortable with it because they think maybe it was invented too quickly or there's not enough research behind it. But there are some people who are really pushing for it, and this could possibly be a way of getting widespread immunity, but that's something to consider moving forward. So that is the information that I have for you. If you're looking for anything else, the CDC has some awesome information. The monoclonal antibody thing is very interesting to read up on if you would like to, and I got most of my information from Johns Hopkins.